Every day, people are looking to get healthier and live longer. You're listening to Stay Young America, where host doctors Walter Gaman and Mark Anderson, along with health and wellness expert Judy Gaman, will help you on your journey to improved wellness. You never know who might drop in. Leading scientists, best-selling authors, and even celebrities. So get ready to stay young, America.
Today we have a great show for you. We're talking about acceptance. Now, you may think, what does that have to do with health? Well, it has a lot to do with health, and we're going to be talking with Dr. Greg Hammer. And Dr. Greg Hammer is a professor at Stanford University School of Medicine, a pediatric intensive care physician, pediatric anesthesiologist, and the author of this incredible book that came out in 2020 that is so relevant. You got to pick it up. Gain Without Pain, the Happiness Handbook for Healthcare Professionals. But it's not just for healthcare professionals. We think a lot of patients should be reading this. And he's a member of the Stanford Well MD Initiative, and Dr. Hammer is currently the chair of the Physician Wellness Task Force for the California Society of Anesthesiologists. He's been a visiting professor and lecturer on wellness at institutions worldwide and teaches GAIN to medical students, residents, and fellows at Stanford. And today, he's going to teach GAIN to us here on Stay Young America. Welcome to the show, Dr. Hammer.
Wonderful to be with you, Judy, and also you, Walter.
Oh, thank you.
So I want to just ask you, I love hearing kind of the backstory. Before we get into acceptance and such, why did you decide to go into medicine?
I was really interested as a child in astronomy, actually. I spent a lot of very cold nights in the winter out on the edge of my driveway outside of Chicago, where the sky was very clear at night, often in the wintertime, usually associated with biting cold weather, but that did not deter me. I got very interested in the interrelationship of everything from the quantum mechanical perspective all the way up to solar evolution. And so I thought I was going to study astronomy. And when I was at university, I actually transferred from one place to another to study astronomy, but also nutritional science. And then I just got very interested in human biology and the interrelationship of everything in the human body as well, from the subcellular micro level to the macro level of the body. And so I decided, out of reasons, I think, partly of practicality, to go into medicine, because in astronomy, my opportunities would have been relatively limited to, an academic career in astronomy, whereas medicine just was sort of a wide open space. So I decided to do that. And when I was in medical school, I found that I really loved working with people in pediatric medicine. It wasn't so much the love of children at the time. That certainly has become quite substantial at this point. But I just really felt a kinship with the people, the other physicians, nurses, other healthcare workers who didn't have big egos, didn't take themselves too seriously, had a sense of humor about things. And so that's why I went into pediatrics. And when I was doing my residency in pediatrics, I just fell in love with critical care. And at that point, anesthesiology and critical care were commonly associated in pediatrics, less so now because of the length of the training. So that's what I decided to do. I did a residency in anesthesiology and then fellowships in pediatric anesthesiology and critical care. And I've never looked back. Love it. And I have a lab as well, so I kind of have 3 different jobs at Stanford, and it's just been terrific.
I'm intrigued by your book, Gain Without Pain, but especially the Happiness Handbook for Healthcare Professionals. So many providers are unhappy in this day and age. They're stressed out. They're burnt out. It's all over the place, and not just doctors, but nurses. Tell us about that book, and tell us briefly how to get that happiness.
That's a great question, Walter. Well, first of all, yes, I got very interested in physician wellness in particular because of the pandemic of burnout. So I joined the newly formed WellMD group at Stanford. And the rubric there, Walter, actually is that professional fulfillment in medicine, and I think this applies to other fields too, is really requires 3 components. Sort of, if you could slice a pie into thirds, 1/3 would be the culture in which we work, 1/3 would be the efficiency of our practice, And the other third, which remains of greatest interest to me, is personal resilience. So you can't have a happy career, if you will, without all of those. So no matter how resilient you are, if your practice is very inefficient and you're staying in the hospital for 2 hours extra every night and missing meals with your family and things with your kids, you're just not going to be fulfilled. And so you have to have a practice that's relatively efficient, that makes sense to you, and you have to work in a culture that supports you and others, and then personal resilience, which is my particular focus, because I think that happiness is really our true nature. And it's veiled by the way our brains have developed through evolution. And I'd be happy to talk about that. I really think there are two ways our brains have developed that interfere with our ability to be happy. And the good news is we can rewire our brains because we have this wonderful quality called neuroplasticity, as you know.
Yeah, we've talked a lot about neuroplasticity. I am curious, and of course we could talk about that again today, but I'm curious, this came out in 2020. The subtitle, it has the word healthcare, or the term healthcare professionals in it. But what you're saying, just like what I'd mentioned to the listeners earlier, is that this actually is so important to anybody. I'm thinking about that pie you described and the pieces to the pie and how important that is to everybody. Was it really geared toward the healthcare professionals because of what was going on in the middle of 2020? Or was that just happened to happen? Did you start writing it before the pandemic, or you knew what the pandemic was even going to be? Or were the two kind of tied?
Actually, no, it was really up and running before the pandemic. But because of the pandemic of burnout among healthcare providers, I got very interested in those domains as really defined by the Stanford WellMD program, and in particular personal resilience. And so I was asked to give a talk on the topic of burnout and what we can do about it, and then another talk, and pretty soon that's mostly what I was talking about instead of my research, for example. And so then I had some sabbatical time, and I just decided, in addition to talking about it, it'd be nice to write about it because I felt like the message could be more widely disseminated. And so that was really before the COVID pandemic. It was spurred by the other pandemic of burnout in medicine.
Mm-hmm. It's kind of prophetic, though, that the release was so perfect. I mean, honestly.
Yes.
So let's talk about acceptance. You call it the empowering paradox. Let's talk a little bit about what is acceptance and how does that play a role in our happiness?
Yes. Well, first of all, let me just say the GAIN method, or the acronym GAIN, which is in the title of the book, includes what I think are the four pillars of happiness, and they are gratitude, acceptance, intention, and non-judgment. And I would say that, Dr. John Kabat-Zinn, with whom you're probably familiar, is one of my heroes. I think he's one of the founders of mindfulness. Mm-hmm. And he defined mindfulness, and I think happiness, if you will, as awareness of the present moment on purpose, non-judgmentally. So there are a couple of the GAIN elements. The on purpose is the intention, because our default mode is to be distracted by anything other than the present and to have a negativity bias. And we're constantly judging, and often with our negativity bias, we're judging negatively, especially ourselves. So acceptance is another component of happiness that's important. And the idea is that as much as there is joy in life, and the G in GAIN is gratitude, so we're grateful for the joyous love we share with others and our health, even if it's imperfect. And we have so many things for which to be grateful, but there's also pain in life. And this is inevitable. And if we resist it, we suffer more. So there's a formula in the book, and Walter, as you know, we love formulas in medicine. Cardiac output equals, et cetera, et cetera. I won't go into it. But the formula is suffering equals pain times resistance. So pain is a definite given. And if we resist it, it increases our suffering. And so how do we resist? Manifestations of resistance can be, say, okay, this is a painful experience I had. I lost a loved one. I try not to think about it. That's resisting it. or I rationalize it, or I depersonalize the other person. Oh, they brought this on themselves. Or, there are many other ways of resisting the truth. And when it comes to pain, suffering equals pain times resistance. So the more we resist, the more we suffer. And I my family is Jewish by heritage. I have sort of a slightly different set of beliefs myself as far as religion goes. But I think of Jesus on the cross and stakes through his wrists and feet and how much pain he must have had. But I also think of him as somebody who transcended resistance. In other words, his acceptance of the pain was complete. And so if you go back to the formula, suffering equals pain times resistance, if the resistance is zero, that is, if there's complete acceptance, then the suffering goes to zero as well. And so we do have to be accepting if we're going to be happy. We have to acknowledge that pain. And so I address that in a very specific way in the book, in my own practice, and in my own teaching.
I think that is a really good analogy of suffering and resistance. I never thought about it the way you just described it, but I think it's excellent. So let's talk a little bit about meditation, and how does meditation play into that?
Meditation, first of all, I think, Judy, is a very broad term. Mm-hmm. So many people think that meditation means you have to sit in a particular position and on the floor.
Fingers to thumbs. We all get the visual, right?
Yes, exactly. And most of us can't do that. We can't sit still for a half an hour without scratching an itch or otherwise. So, but people think that that's what meditation is, and they also think that to meditate, it means banishing all thoughts from your head. So I would like to present a counterpoint to that view, which is that meditation doesn't have to be that way. And the gain meditation actually is done in as little as 3 to 5 minutes. And you can sit wherever you like. You can do it while you're standing or walking even. And the idea is that instead of trying to get rid of every thought in your head, you actually have a guided sequence of thoughts. So we get in touch with the breath. We focus on the breath. We slow it down. This kind of lowers the adrenaline in our body. Our heart rate goes down as our breathing rate goes down. Our blood pressure goes down. We focus on the breath, the magic of the breath. And then we transition to contemplating that for which we're grateful. So we can start with the gratitude for the breath. I'm grateful for being able to draw this breath, the magic of the air passing through my nose and into my chest and expanding my lungs and my body. I'm grateful. And so we go through things for which we're grateful, the love in our life, etc. Then we transition to acceptance. And actually, there are many things that we can think about that are painful. I unfortunately lost my son at the age of 29 5 years ago. So that's easy for me to put front and center during my gain meditation. And I bring that closer and closer, and I actually envision opening my chest and opening my heart and bringing that pain into my heart and embracing it, sort of enveloping that pain with my heart. And at that point, there's no distance between something called me and something called the pain. And if I ask myself the question, can I live with this pain forever? The answer is yes. And I think that's extremely important. We don't want to think about painful things all the time. But we have to think about them to the extent that we can accept them in our life and in our heart. And, as the Serenity Prayer would have it, we need to discern between what we can change and what we cannot change. And things we can change that we have the time and energy to work on, we should commit to. But things that we cannot change, that we don't like, and let's face it, the world doesn't comport to our wants and needs necessarily. So those things we need to accept. And I think this is something that we need to kind of take on front and center. Well, and then we transition to intention and non-judgment.
Well, let me stop on acceptance for a minute because I want to have a little discussion with Walter about this. Do you find in your patients, because being primary care, sometimes you have to deliver news that maybe is a little hard for them to hear. And sometimes it could just be, hey, you got to stop drinking alcohol, or you got to, something that they're resistant to. Other times it's a tough diagnosis, or maybe you're just telling them they got to change their lifestyle, whatever it is. Do you find that the patients that move from the resistance to the acceptance sooner live longer?
Well, I can't say whether they live longer or not, but they certainly are more, content, more resolved. I mean, it's basically moving through the Kubler-Ross different sequences of grieving, and when they finally come to an acceptance, then they are more. Well, that's what's the word? They're happier. They're more content. I can't quite come up with the right word, but they do better in life. They're able to move on. Well,
because we in executive medicine in Texas, we often see whole families. They'll be like on family concierge and such. In your experience, when you see a patient or a family, and some member of that family has a change or they have to accept something new, do you see the sooner they accept it, a better relationship within those families?
Definitely.
I mean, I'm just thinking of a couple of situations, and I'm thinking, I see that. I can kind of look and think about those patients that maybe, okay, we found some significant blockage. You need to see the cardiologist. We need to move forward with this. The sooner they take ownership of whatever that health issue is, the less issue that the spouse has or the children have, and they move through it together as a unit. Is this making sense to you, Dr. Hammer? Do you kind of see this in family units, or have you seen this in your experience?
Absolutely. And I deal with a lot of death and dying in the intensive care unit, and families being saddled with awful diagnoses, and when they resist it, when they fight it, it actually, I can think of examples where I'm in a patient's room in the intensive care unit, or in a preoperative room in an exam room with a patient and their family. If the family is sort of resisting and pushing back and not at peace, it certainly affects the child as well. And I think, for example, for a child who's having a surgical procedure or a general anesthetic for a diagnostic procedure, if their parents are at peace and calm, then they tend to be at peace and calm as well. And this affects their recovery as well. So I think that it's a very holistic concept that is acceptance, and that's why, it's part of the GAIN acronym, because I think it's so important to happiness and, peace.
Yeah, I was thinking about your situation as a doctor in intensive care and in OR, in around those very traumatic situations. And how do you, and I'm going to ask this of both of you in your different scenarios, how do you as a physician help your patients and your patient families move into a state of acceptance? And we'll start with you, Dr. Hammer.
I think the first element, and Walter can chime in on this as well, is how do I deal with the family and the patient? So I often will pause outside the room as I'm about to enter a patient's room in the intensive care unit and get in touch with my breathing and get in touch with my gratitude, acceptance, intention, and non-judgment, and center myself and get myself into the present moment. And then when I'm in the room, I think that resonates, and that helps families feel the same way. There's a calm. They often know the medical science from, maybe they have a chronically ill child, or others, my residents and fellows and other attendings have explained things to them. Sometimes, in some cases, all I can do is offer that presence. And, so I think the first thing is that we have to be accepting. And then I think we can demonstrate that peace and presence to our patients and families. And so that's the start.
Yeah, I couldn't agree more that we have to be at peace with the diagnosis. We have to accept what's going on, even if it's bad, And then I find with families, you cannot sugarcoat the news. You have to be completely and utterly honest and not offer false hope.
Yeah.
Absolutely agree with that, Walter.
Yeah, and that may sound cold, but I feel like you would be setting them up for disappointment.
No doubt.
Yeah, I
No
think
doubt.
that early in my career, I tried to present a more optimistic view. If a child was faced with a potentially fatal disease or sepsis, what have you, and I found that there was a resistance to that on my own part, that I was not fully accepting the patient's circumstances and sort of facilitating the parents resisting the reality as well. And so I think that comes with maturity and practicing medicine for more than a few years.
Yeah, I was just thinking about my own recent experience in the trauma ICU. My mom passed away. She passed away after a horrific fall. And the sooner I independently came to the conclusion that this probably won't end well. And it wasn't about being negative. People are like, oh, sometimes you hear people say to you, well, you're just being negative. You should have hope. Where's your faith? It wasn't a matter of faith. It wasn't a matter of hope. It was a matter of the reality. And gosh, would it have been great if things would have turned out differently? Yeah, but it didn't. And the reality was the chances of that happening were pretty slim. And it wasn't a matter of faith, because I think faith is about accepting the outcome either way. Not, I'm only going to have faith if this turns the way I want it to turn. Is that a kind of a fine line, or do you find that in children of parents? Because I think when your parent passes, the children are always thinking their parents are going to survive anything. They've always seen them survive things. And maybe because you deal mostly with the children, this might be a question for Walter, but either one of you can step in. But do you find that when it's the parent in the bed, even regardless of the situation, and it's the child, that acceptance can be harder?
Oh, I think it's very difficult, but it's essential. And so I think as caretakers, we need to help families accept, and they do that through first understanding what's happening and not having it sugarcoated, as Walter said.
Yeah.
And as far as faith, I think I'm mostly aligned with the teachings of Advaita, and Krishnamurti said, I don't mind what happens. And that is a really beautiful way of summing up acceptance. And that is that, we're all going to die. And when I decided to go into intensive care and cardiac anesthesia, I realized I'd be dealing with a lot of death and dying, and I thought, I've really got to come to terms with this myself if I'm going to take care of patients. So I spent a lot of time early in my career really having that concept front and center, and I think that has served me well.
I think the best quote I ever heard was out of a pastor once, and this particular pastor said, none of us get out of this alive. And it was the first time I had ever really had that, oh my gosh, he's right. I don't know why I never had allowed myself maybe to kind of think about that. You just kind of think you'll live forever, or you think these people around you are going to live forever, but nobody's getting out of this alive. So, I'm not talking about afterlife or anything like that. I'm just talking about, the physical body living on the earth. But that was a weird thing. Do you remember that moment, either of you, when you kind of had that realization?
Well, I remember the pastor saying that,
Yeah.
and I think there was a lot of chuckling about that, but it was sort of a chuckle of realization.
Yeah.
Yeah. Getting back on a comment, I've lost both my parents, and I lost an infant little boy. And I must say, losing the parents, as painful as it was nowhere as painful as losing a child. That the pain from losing a child was so much more indescribable than losing your parents that are elderly.
Yes, I totally agree with you, Walter. Certainly, when our family members, our parents, their friends that we know so well pass away at an old age and they've had a good life, that's just sort of part of the natural cycle of life on the planet. And it's quite a bit different when you lose a child, absolutely. And so I think that helps me bring that acceptance to families whose children are at risk. And, again, I think that acceptance is an extremely important part of medicine.
Yeah, I agree. This has been such a great conversation with you, Dr. Hammer, and I want to remind our listeners to pick up Gain Without Pain, the Happiness Handbook for Healthcare Professionals. You don't have to be a healthcare professional. This is very good advice. This is a great system identifying 4 different ways out of the pain and into happiness. And thank you, Dr. Hammer, for being on the show. What website would you like to give out that you like to refer people to?
My primary website for the Gain endeavors is GregHammerMD.com, GregHammerMD.com.
Yeah, so that's great. We'll put it in the show notes as well. And this and every episode of the Stay Young America podcast is brought to you by Executive Medicine of Texas. At Executive Medicine of Texas, we understand that true health can only be found when you treat the patient as a whole. And that's why our executive physical exams are second to none in the amount of testing and information we gather prior to making a wellness plan for our patients. Learn more about how you can take advantage of your health at emtexas.com. That's emtexas.com.
Our website is stayyoungamerica.com. That's stayyoungamerica.com. Twitter at StayYoungPod, at StayYoungPod. Facebook at Stay Young America, ! Don't forget that exclamation mark.
That's right. And join us next time as we're going to be talking about psoriasis. So if you suffer or you know someone who suffers from psoriasis, it's a show you won't want to miss.
You've been listening to a podcast of Stay Young America. Learn more by visiting StayYoungAmerica.com. If you have a topic you'd like us to cover, call 844-WELL-100. Until next time, stay young, America.